Hello, everyone, and welcome to my presentation on diabetes. We're going to be reviewing the nutrition considerations for this disease. My name is Monica Schwint. I'm a registered dietitian and certified diabetes educator working at Marley Nutrition and Fitness. So first, I want to address some different statements that I hear circulating regarding diabetes. Some of these statements are true and others are actually myths. So let's go through a couple of them. The first thing I hear is that diabetes is caused by eating too much sugar. So take a moment to think if you've been believing this is true or false. It's all actually false or considered a myth. Diabetes, we know, is quite a complex disease, and there are a lot of different factors that can lead to someone developing diabetes. Some of these are within our control, such as lifestyle factors with, yes, our diet, our exercise patterns, and our weight management. But there's also a lot of non-modifiable risk factors to diabetes, such as your age, gender, other comorbidities, and also your family history. So genetics can lead to people having a higher risk of diabetes. It's not simply that someone ate a bunch of sugar or just had a lot of candy in their diet, and that led to the disease. Next statement is that people with diabetes shouldn't eat bread or rice. So I have a lot of first-time clients coming to me saying, they've completely cut these out of their diet. This is actually false. We can still fit carbohydrates, which bread and rice fall into that category, into everyone's diet. We might need to do more moderation considerations, but people with diabetes can absolutely still consume bread and rice. Third, fruit is good for people with diabetes. This one is finally true. So, on the flip side, I hear that people are concerned that fruit is bad if you have diabetes. While fruit does contain natural sugars, and so it does create what we call a glycemic response or raise your blood sugar, fruit is full of good micronutrients, vitamins, minerals, and fiber. So lots of benefits for our body, and it does not need to be avoided by people with diabetes. And the last one I wanted to address was, concerning medications with diabetes. So a lot of times the first line therapy is going to be metformin or maybe one of your GLP-1 medications. Farther down the line, sometimes people are put on insulin. So I just want to highlight that if you are put on insulin, it does not indicate failure on the patient's part. Sometimes this disease is just generally progressive. It can become harder to manage over time, and our bodies, our pancreas might actually produce less insulin over time. So if you are put on insulin as a medication, it doesn't mean you have failed. It just means that the disease has progressed and your doctor is recommending a more intensive maybe treatment option for you. All right, so first I just kind of want to give an overview of why nutrition matters so much. So diabetes is actually a disease where nutrition is a big component. Nutrition counseling is recommended by the American Diabetes Association for all adults with diabetes, but also with a pre-diabetes diagnosis, okay? Because we can tackle a lot of the risk factors for diabetes even when we're starting to see patients with labs in the pre-diabetes range. Nutrition counseling has been shown to reduce A1C by up to 2% on its own. So that's outside of the other interventions we can do with medications and things like that. Nutrition is going to address a lot of pieces of diabetes. So of course, it can address the blood sugar management aspect, but it also addresses comorbidities such as obesity or overweight, so weight conditions, and then cardiovascular disease, such as, things like blood pressure, cholesterol, all of your heart health components can also be addressed by nutrition. And then I just wanted to highlight, this is a phrase taken from the American Diabetes Association, but our goal with nutrition therapy is really to actually maintain the patient's pleasure of eating by providing positive messages about food choices. And we really only limit food choices when absolutely indicated by scientific evidence. So AKA, dietitians are not the food police. I still enjoy a donut myself here and there. And so, we actually really want to be able to highlight what you can eat rather than take foods away. And then finally, I just want to throw in this caveat, there really is no one size fits all eating plan for everyone. It needs to be tailored to each individual. We all have different nutritional needs. So while this presentation is going to go over some generalized topics, it's best to meet with a dietitian and get your specific recommendations. All right, so going into diabetes nutrition, first off, I just want you to think about, do you know what macronutrients are or how many there are? Let's dive into it. So sometimes we call macronutrients macros for short. There are 3 of them: protein, carbs, and fats. And so macro, means big. So these are the 3 big components in any of the foods that we eat. A lot of times we can categorize foods into one of these 3 categories, but keep in mind some foods are complex and they might have components of both carbs and proteins. So we'll talk about that here in a minute. And then for those that don't know, yes, carbohydrates, the shortened term for that is carbs. So you'll hear me use those interchangeably in this talk. All right, so when we're looking at these 3 macros, though, we're really going to zone in on carbs. Carbs show the largest blood sugar response, and that's because carbohydrates essentially break down into those glucose molecules that we're talking about. So if you're looking at the graph on the screen, you'll see that carbs do have the largest blood glucose response. Many people don't know this, but protein and fat do break down a little bit into glucose, and so there will be some slight blood sugar raise if you ate just a straight protein or just a straight fat food. But really, carbs are the major player here. So let me walk you through, just kind of the normal carb digestion. Okay, let's say we eat a piece of bread, which is a carb food. Those carbs enter down into our stomach. They're broken down by our digestive enzymes into smaller molecules called glucose. Now, sometimes we'll just call that sugar molecules, but the medical term is glucose. So those you'll also hear me speak about interchangeably. Once it's broken down in our stomach, it's absorbed through our intestinal tract. Those glucose molecules enter your bloodstream. So for absolutely everyone, after we eat carbs, our blood sugar level is going to rise. That's normal. The glucose molecules are going to be transported through our bloodstream to all the different cells in our body. When the glucose gets to the cell, there's a hormone called insulin that acts as a key to let glucose into the cell. When this happens, the door is unlocked, glucose leaves the bloodstream, enters the cell, gets used for energy, and what we look at with our blood sugar levels, those decrease. Now, if we go back to where you see the X, that's a disorder in this process when we talk about diabetes. So it's right where insulin comes in. In diabetes, we have difficulty with how our insulin is working. So we usually call this insulin resistance. You can kind of think about it as either not enough keys circulating, or if it's a deformed key, it's having a harder time fitting in that lock. So this whole process gets slowed down. And when insulin isn't working, then suddenly, glucose is not able to leave the blood and enter the cell. Your blood sugar remains high, which can cause damage to your actual blood vessels when that glucose is sticking around in the bloodstream so long. It can cause damage to different parts of the body and the complications we know about from diabetes. And then your cells also are just not getting that glucose that they need for energy. So lots of problems that happen when insulin is not working well. Here's another graphic that I really like that helps simplify this. So again, in the blue area is your bloodstream. You can see all the little glucose molecules in there. They're coming up to that cell. And then insulin is that hormone that's like opening up the cell door and letting the glucose out of the bloodstream. So when we have problems with that key, then the glucose is trapped in the blood rather than getting to your cells. All right, so let's just quickly review, the types of carb foods. Most people think about, of course, bread, rice, and pasta. So your grain foods, oats, cereal, and then lesser known grains like quinoa, couscous, barley, all of those things. We also throw a couple vegetables in the carb category. Those are ones that are starchy. So your potatoes, corn, and peas for the most part. There are also 2 food groups with naturally occurring sugars. So dairy and fruit are also in that carb category. And then finally, legumes. So your beans, lentils, chickpeas, which again are a type of bean. Those ones do actually contain a bit of protein content as well, but it is important to know that beans and lentils are quite starchy, so they do count in the carb food category. When it comes to carbs, the type of carb really matters, okay? We want to be choosing more complex carb sources over refined carbs. So refined carbs, as you can see, tend to be your more highly processed products. Those are things that use, white flours, or are really like broken down, very, there's no roughage to them. There's no grain. There's less fiber. Those lead to quicker blood sugar spikes, and sometimes higher blood sugar spikes compared to complex carbs. Those are going to digest slower because of the fiber content, and they're usually going to come along with even more nutrients in them as well, like B vitamins, iron, and a lot of other things. So overall, we want to lean more towards the foods on the right. All right. So, any idea how many grams of carbs you might usually, eat at a single meal, or how much you should aim for? Let's talk about that. So, a lot of people don't realize carbohydrates are going to be the major component of our diet. It should be more than half of where our calories come from generally. So, about 45 to 65% of your calories are going to come from carbs, because carbs are our main energy source. They are our quick energy. Protein, is for muscle building and sustaining that. And then fat is great for our skin health and also for our cells. But carbs, again, are our main energy. So we need a good amount of them throughout the day. We don't want to cut carbs too much. So there's a lot of numbers on the screen, but I'll just say simply, a lot of times a breakdown for women, because a lot of times they end up around, maybe a 1,500 calorie goal, would be about 45 grams of carbs per meal and 15 to 20 grams of carbs per snack. For men, since they typically have a little bit higher calorie needs, if we're averaging a 2,000 calorie diet, they would be looking more at like 60 to 75 grams of carbs per meal. And usually still the same, maybe 20 grams of carbs per snack. Okay, and then you see all my asterisks. So there's really not an ideal percentage for everyone, but a dietitian can guide you in the right direction of what your body might need, depending on how much cardiovascular exercise you do, really how active you are versus strength training, and all of those different factors. I just wanted to touch a little bit on weight management. A lot of people kind of know the basics of this, but want to highlight that losing weight actually does improve our body's insulin sensitivity. So if you think back to that slide, it really helps those keys work better, and lower our blood sugars. Excess weight, and especially fat mass, can drive insulin resistance and make that process worse. So weight management can be a big piece of diabetes care. Typically, we need to reduce our calorie intake, eat less than we're currently eating to maintain our weight in order to lose weight. So usually a dietitian will recommend maybe 500 to 750 calorie deficit each day from what you're usually eating. And that generally results in a weight loss of about 1 to 2 pounds per week. Now, I know that rate, might sound a little bit slow for some people, but that's really what's recommended, especially for consistent and sustainable results. And even just those first 5 to 7% weight loss, for most people, equates to massive health benefits. So we do see reductions in A1C if someone's starting out, maybe at 200 pounds and then loses that first 10 pounds and gets down to 190. We do see improvements in their A1C numbers. All right, now I'd like to talk about my absolutely favorite and go-to method for meal planning. The plate method is very popular, circulated by the American Diabetes Association, and it's just a great tool to have in your back pocket for if you're eating at home, if you're eating out, you can apply this principle. All right. So it's all about how we break down our plate. Step one is we want to, divide up our plate. First, we're going to divide it in half and try to fill the half with non-starchy vegetables. So I have a lot of examples listed on the screen, but that's essentially all of your veggies outside of the potatoes, corn, and peas. So it can be green vegetables. It can be red and orange and yellow bell peppers. Any of those things, squash, zucchini, tomatoes, could be a side salad. It could be a big old pan of roasted broccoli. Any of those are great options. One reason we want to try to fill half of our plate with vegetables first is they're, very filling. They're going to be lower calorie and actually high in nutrients, all of the vitamins and minerals we need on top of fiber. Fiber is digested more slowly, so it literally helps keep us full for longer while eating less calories if we're trying to achieve that calorie deficit for weight management. Step two, 1/4 of our plate we want to fill with a protein source, preferably something lean, because the types of fats that are in animal products is generally saturated fat, which is the kind that's known to raise our bad cholesterol levels and clog our arteries. So, big lean proteins to focus on would be chicken, turkey, and eggs. And then, of course, if you want to have beef or pork, having leaner cuts of those, like the ones listed. Fish is also great in this category, especially we focus on that a lot for a Mediterranean diet, which is what's recommended for most people. Fish have omega-3, heart-healthy fats, and anti-inflammatory properties. Dairy is also a protein source, so you see cheese and cottage cheese listed there, and then the plant sources of protein, like your beans and lentils, which again, I did mention those contain carbs a little bit as well, so that's an important consideration. But you could also do edamame, nuts, tofu, plant substitutes. And then that final 1/4 of your plate, that's where our carbs come in. And so they should kind of be the third thought, right? We don't want our plates to the main feature to be carbs. So if you think of a big old bowl of pasta or just a big entree of fried rice, those are going to be very carb heavy meals compared to what we're looking for in this plate method model. So examples of healthy complex carbs that are going to contain more fiber, give you more nutrients, and promote fullness are going to be potatoes, sweet potatoes, oats, brown rice, quinoa, whole wheat breads and tortillas, and then whole grain pastas, as much as you can look for those varieties, or high fiber pastas. And then again, beans and peas are kind of in that category, so they're mixed in between the carb and protein food. Fruit can go here as well. I'd say, especially on a lunch plate, sometimes fruit is our carb portion. So I'm just going to run through a couple images that are produced by the American Diabetes Associations to really give you examples of what these plates are going to look like. So this is the classic placemat. Now you can see they have 2 different types of non-starchy vegetables on the left-hand side. So you don't have to have just one big old half plate of green beans. You can do, carrots as a separate thing as well. So really they have, 4 different items here for diversity. Chicken is their main protein source, and then potatoes are filling that last category for the carbs. This is the Hispanic plate mat. So features chicken again, and then, a good variety of vegetables on the left-hand side, some healthy fats and fiber from that avocado. And then the carb source is going to be your rice and beans. So notice how we don't want half of the plate to be, rice and beans. It's only taking up 1/4 of the plate there. This is an Indian placemat, so we have a nice piece of fish there for our protein, and then some cooked green beans, roast beets, rice, right on in there. So rice is that carb category, it looks like, with some lentils as well. And then this is our southern plate mat. So example of, I think that's like a chicken thigh, sweet potatoes, cooked greens, and summer squash. All right, let's switch into reading food labels. This is, a good basic skill to have so that you're more confident, especially when you're making choices at the grocery store, trying to compare products. So just a reflection moment, how often are you reading nutrition labels right now? What part of the label do you typically go to first? What are you most concerned with? Do you jump straight to sugars? Do you look at the calories? Let's talk about all of that. So very, very first thing you always want to do when reading a label is look at the serving size, okay? That's important instead of just jumping right into the nutrients, because the serving size might not be the actual amount that you're going to consume. So we want to make sure that we know how to, use these numbers and it's realistic to the portion that we are eating, that we are consuming, okay? So you can see that always listed near the top of the label. On this one, it's the 1 cup serving size. But if I'm going to eat, 2 cups, then I'm going to need to double everything. You can also see this one actually does happen to have that second column that shows you the per container serving size. So if you consumed the full container of this, which it looks like maybe there's 2 cups in there since it's exactly doubled. All right, so after you've made sure you double check the serving size, then we can go down for diabetes. I'll talk about carbs first. So you can look at that total carb line. A lot of times with carb counting, we'll say 15 grams of carbs is one serving. As I mentioned earlier, for women, a lot of times we're looking at 45 grams of carbs. So that's easy to divide by 15 and get, look for 3 servings there on that. For men, it's more like 60. So they would get 4 servings of 15 grams of carbs. But you can really just stick with, the grams number. I also like to point out that you do not need to look at the sugar line here. The sugar line is indented under that bold total carb line. So that means the grams of sugar are actually part of that total. So the 7 grams of sugars that it shows here is included in that 35 grams of total carbs. So now I want to talk about, some nutrients that we actually want to get enough of. So we're not focused on just all the things we need to limit in our diet, but things that we want to increase in our diet. So any idea how much fiber you should have per day? Let's talk about that. So fiber is always going to be listed. Again, it's indented under the total carb line since it is a type of carbohydrate. Products are allowed to put the high fiber claim if their product has 5 or more grams of fiber per serving. Okay. Or good source of fiber means it has 2.5 grams or more. So fiber needs do actually vary. But to answer the question, it'd be 21 grams per day for women under 50. 25 grams for younger women. Women above 50, looking more like 21 grams per day. For young men under 50, 38 grams per day. For men above 50, 30 grams. So anywhere from the range of 21 up to 38 grams per day. Okay. The other big nutrient we want to get enough of in our diet, again, because it's digested slower, just like fiber, is protein. Again, protein supports our muscle mass, so we don't want to skimp on that too much, especially if you are regularly doing strength training, body weight exercises, or with barbells. So protein needs vary a lot. I didn't really want to touch on that in this presentation, but again, dietitians are great resources to calculate your individualized protein recommendation. Keep in mind, a lot of supplements or bars usually have like maybe 20 to 30 grams. I would say a product has a decent amount of fiber as a snack food if it has, at least 5 grams. Anything under that, that's a bit skimpy on protein. But at meals for, a lot of men and women, you're looking at, anywhere from like 30 to 50 grams of protein. But again, those are just kind of throwing out some different numbers. I have heard a lot of people, that look at the percent daily values, that percent DV there. I actually discourage looking at those mostly because those are only ever going to be based on a 2,000 calorie diet, which is not necessarily the calories for you as an individual. So overall, I would scrap those. I would focus more on the exact grams. All right, so back to some nutrients that we do want to limit. Sodium is going to be one of those. So any idea how much sodium you should have per day? Well, the answer is going to be under 2,300 milligrams per day for most people. If you do have a history of high blood pressure or heart failure, we want to limit sodium a little bit further. So usually more like 1,500 to 2,000 milligrams. So what does that mean for you? A lot of times with my patients, I'll break that down, by meal. So if we are having 3 meals in a day, plus maybe some snacks, you usually don't want to have more than, 600 milligrams in a single meal serving. So a couple of different ways to break that down, but if you had 600 at 3 meals, that's 1,800 milligrams. And then you have a little bit wiggle room for sodium in snack foods. Going back up to the first thing in this slide, the calories. Of course, those are going to be most important to look at when you are trying to manage your weight, since we need to create that calorie deficit. So that you would, again, use your individualized goal. If you have a 1,500 calorie goal set by your dietitian, usually for women, you need to keep your 3 meals under 500 calories, right? So breaking everything down for your individualized goals. Saturated fat, again, this is the kind that's not healthy for our heart, so we do want to limit it. Usually, the American Heart Association says less than anywhere from 6 to 10% of your daily calories. So, really don't want to be exceeding 22 grams of saturated fat in a day generally. And then finally, added sugar. This is sugar that is literally added during the manufacturing process for the food. So it's usually found in your more processed or packaged food products, but even protein bars will have this. A lot of yogurt products will have sugars added. So just something to pay attention to. We do want to limit sugar in our diet since it can contribute to kind of excess calories without a lot of nutritional value. So you can see the recommended numbers there for men and women per day. And so wrapping up reading food labels, just kind of wanted to throw these two granola labels out there for comparison as a general practice. So label A, first of all, we want to double check we're comparing the same serving sizes, right? So label A says serving size is a third cup. We would want to make sure we're looking at that first or left-hand column for label B, since that one is also 1/3 cup. And that way we're comparing exactly apples to apples or granolas to granolas. So they both, it looks like, have the same amount of calories, 130 for that serving size. But product B does have more fat. Of that fat, let's see, only 1.5 grams is saturated fat. So though, while it looks like it's, kind of a higher fat product that might dissuade you to start, it actually has more of the heart healthy fat content, all of those unsaturated fats that are listed, poly and mono, right there. So in the fat category, I would actually say label B is the winner. For sodium, label B is also the winner since it has less sodium at 115 milligrams compared to 135. When we're looking at carbs, label B is going to have less carbs. And of those carbs, more of it is actually fiber. So it has 4 grams of fiber compared to label A has 2 grams. And label B does not have any added sugar. So that's a huge A+ win for that one compared to product A has 7 grams of added sugar. Product B also has more protein, which again is something we are looking for, 7 grams versus 3. So I would say for me, the clear winner here is product B. But of course, the last consideration is always going to be taste. So we would have to taste test these and see, if you really loved the taste of product A more. I'm never going to say you can't eat it. We're just going to talk about, the difference in nutritional values for that one compared to label B. All right, so that brings us really to our summary. The main points I want you to take away from this is number one, carbs are not evil, but we should be aware that they do produce a glucose response. So we don't want to consume a large amount of carbs within one meal sitting because that can spike our blood sugar. We want to pair them generally with healthy protein and fiber sources so it's all digested slower and we don't have that huge rush of glucose molecules into the bloodstream. Because if our insulin, those keys that are circulating, are not working well to get blood sugar out of the sugar out of the bloodstream, that creates issues. When we are having carbs, we want to make sure we're choosing complex ones over the refined carbs. So all those pastries and white bread, white flour products. You can utilize the plate method for easy meal planning. That's a great visualization to apply when you are ordering out or when you're creating meals at home, making sure especially that you have that step one, a lot of non-starchy vegetables on your plate. Again, protein and fiber for satiety. And then finally, as you've heard me say multiple times, everyone's nutrient needs are different. So it really is best to consult with a dietitian to get your individualized recommendations. So here is my plug for, what support looks like with Marley Nutrition and Fitness. A lot of us do know these basics of nutrition, but sometimes we don't always have a plan, or sometimes we need that account or accountability and support piece of things. So that's where we come in. Our dietitians work with clients one-on-one. We meet you where you're at. We do an assessment with you, figure out, what your eating schedule looks like, your food preferences, your specific goals, and then we'll tailor a game plan for you and then continue to adjust it as we need, as life happens or as you meet goals, we can add new ones. So the big piece of this is that a lot of people don't realize insurance does cover nutrition counseling. It's typically covered fully, so it's often $0 out of pocket. Some plans are actually unlimited sessions or have a really generous number of visits that are allowed. A lot of times you don't even have to have any kind of health condition to qualify and don't have to go through the hassle of getting any type of PCP referral. So your next step, if you're interested in getting scheduled with one of our dietitians, is just text MNF to the following number. Thank you so much for listening today.